psychiatrist, definite authority. Deciding I would use an abandoned crack house as my new psychiatric institution. I realized with myself in charge, I would probably be able to do some good for the community, the mentally ill. I decided that the people most in need of help are those who were in a state of denial, such as the people I saw walking down the street every day. It did seem to me that they believed that they were sane. Those in need of help are always the ones who most resist. But yet, I did manage to abduct about 12 different women, 3 men, a couple of priests, locking them up securely for their own safety in the different rooms, chaining them so they wouldn't hurt themselves. I decided that I would put my plans into action, for each one of them needed intensive therapy. Still, many were resistant to treatment. I had to drug them with doses of psychedelics in order to open them up emotionally and expose the trauma they had experienced in childhood, which had led them to this frightful condition. Finding out many different things about the individuals. Over the period of the next 3 months, I learned that these people were in need of special help, special techniques, radical therapies that had not yet been used by the other institutions. Antipsychotics were clearly out of the question. The drugs they had made only exacerbated their psychosis, making them believe that they were more in touch with reality. So I did decide intensive therapy would include subjection to intense pain over long periods of time in order to help them come to terms with their inner demons. Recording all of our sessions on tape, I realized it would be fun to listen to later. Yes, for they were interesting specimens. In fact, one happened to be a psychiatrist himself. He was the most resistant to treatment of all of them, for he believed that he was somehow superior and more sane than the other mentally ill patients. I had decided that there might be a virus involved of some sort. It was highly contagious. If it existed, the majority of the American population had succumbed to it. Still, the psychiatrist did finally succumb to my therapy. I found that the mega doses of LSD and mushrooms, combined with heavy doses of mescaline, did in fact alter his personality after the period of about a month and a half. He was finally becoming more rational. Often he would tell me of the things he saw, and I was very proud that he was no longer hallucinating. He was finally seeing things as they really were. After much consideration, I decided he had been permanently cured and would never revert back to his former state of insanity. So I did let him go back to his position within society. Unfortunately, he was not able to assimilate back into society. Dealing with so many insane people around him, I could understand why they labeled him myself insane. And it was a very twisted world. The majority of the population were in desperate need of help. Yet the other patients in my institution, they did manage to make progress in many significant ways. The priest was finally coming to terms with his delusion about God, the devil. I told him the truth, none of it existed. But still, the priest could never be cured. For he had revealed during the therapy sessions on LSD his fascination and attraction with young boys. I could never let him go back into society. So I decided that the best solution would be euthanasia. Still, it had been an interesting case which I had learned much from. I made a note of it in my report that many priests may suffer from the same condition. But despite my failure in curing the priest, I was very impressed and proud of my other patients, for after repeatedly feeding them large amounts of datura, they had finally come to the realization that they and their personalities had been warped, fragmented. They had finally found their true identities, though many of them, when I spoke to them, no longer could remember their name or respond at times. Still, I thought they would be productive citizens in society, so I did release them back into the general population, using my best judgment, of course. Overall, the other patients did make progress, so I decided that I would keep my institution open for another 6 months.